Hi everybody, I'm Dr. Kestler from Lorain County Community College with another update. Today is the 17th. It is St. Patrick's Day. I'm not wearing green, I just realized that. I'm not voting today. I was hoping to give you an update about my voting experience, but I'm not voting today, but I will be in the future. All right, on today's video, I would like to cover a couple of things. Number one, I really want to drive home the fact that this is a real thing and it's happening here in the United States. And I've put up a map from the CDC. We are starting to track the virus in the CDC. And you can see here there's about over 3,000, almost 3,500 cases in the United States total. But I've labeled a couple of places on here. I've labeled Washington and New York. So this is not someplace else. This is not some other country. This is right here. You can see in Washington there's 909 cases. In New York there's 950 cases. But there's something else up here that I want you to pay attention to. And there are 48 deaths in Washington. And there are 10 deaths in New York. So I've heard on the media lately that people are saying things like, oh, New York is doing a better job. I think that was an article in one of the papers broadcast or published this week. And the fact of the matter is, did you notice that I wrote the dates on these two? I have January 21st is the first Washington, and March 1st is the first New York case. So Washington has been, this has been going on for a much longer period of time. And so we have to be aware of that. I don't think that you can say there's a real difference between the two areas. It would be nice to say that. One of the things you can see from this, this is from the CDC as of yesterday, and you can see that every single state in Alaska and Hawaii have cases. One exception is West Virginia, still does not have cases. And we're going to see more. We're going to see that, pretty soon we're going to see a lot more cases in New York. I will guarantee you we're going to see more cases in Ohio. One of the things that I was thinking about today is the way that people are responding. And this is a very human nature kind of thing. People are in denial in early parts of a pandemic. That is always the case. Back in the HIV epidemic, which I'm very familiar with, there was an initial disbelief. There was an initial doubt in the general population, and even the affected populations, there was doubt. In fact, Randy Schultz published a book called "And the Band Played On." That book was a reference to the Titanic, where the band kept playing as the ship was going down. And so eventually it took something real big to get everybody on board. And that real big thing was, I think, the death of Rock Hudson. That was for those of you who are young, he was an actor in the United States. And that's what caused America to change its ideas about that epidemic, that pandemic. HIV is a pandemic. So this is a real thing. We're going to be seeing this in every single state that I'm looking at so far. I see that the number of cases is going up. As soon as I start to see them leveling off, I will let you know. I'm tracking that. Italy is also still going up. China, as I mentioned already, has leveled off. South Korea has leveled off. And so I'll keep you aware of all that kind of stuff. I want to spend some time talking about some of the questions that people have been asking me already. And this one is coming from the website. Hi, Dr. Kestler. How long do you think this pandemic will continue to be this serious? I expect at least four weeks, probably 8 weeks. And when it will be safe to reopen the schools and the restaurants again will be when we start to see cases go away, where we can start to realize, and when we develop a good test for seeing who has already been exposed. That's an important consideration as well. The next question is, this is actually a four-part question. After the general exposure, after the general population has been exposed to this, when will we develop antibodies to fight it off? And that will occur fairly soon after the infection. I would guess somewhere in the neighborhood of within 5 days or so. What it is we'd like to measure those antibodies to see who has been infected, because that can tell you somebody who's been infected and has gotten better. Once we've had it, the second part of this question, will we not get it again? We're thinking we don't see a lot of that going on right now, and there is evidence that it does not occur. I like to answer the last part of the question, and the last part says, will we be more susceptible to getting it again? Actually, less. We suspect that we'll be less susceptible to getting it again. And in fact, if we do get it again, if you do get it twice, the second case will be less strong as the first case. The second time you get it, you'll have less severe effects than the first. Now, the next question is a rather complicated one, and it's talking about scar tissue left on the lung after a rather hefty respiratory component. Will it leave scar tissue? And since this is an infection that is generally for even the sickest of people, that lasts maybe 14 days, I don't believe you will see a lot of effects. Tuberculosis, however, which lasts months, does leave an effect, and tuberculosis is a different kind of a story because it actually gets inside of the cells and causes damage inside of your own tissue, and that produces scar tissue. I haven't seen any evidence of this yet, but I will keep my eyes open for that. That's a very good question. And then the next question is, do you think after we have kept ourselves away from others and then we get back together again, there'll be an influx of outbreaks to those who haven't been exposed? And the answer is yes. You see these things go in waves and come back, but the second wave is not as bad as the first. The third wave is not as bad as the second, and they get better and better as more and more people become immune. Of course, we are all waiting. I do have some news that there are very, 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 very preliminary vaccine tests going on in the United States right now, and I would just caution you about getting excited about that because it's a long way from being actually happening. And then the last question I think I'm going to go through on this today is about children. And it is true, although there was a paper written a couple weeks ago in the New England Journal of Medicine that described children who had the disease. For the most part, children don't get infected, or they do get a mild case of it. I shouldn't say not get infected at all. We believe that they get a mild case of the coronavirus, of the COVID-19, and they don't seem to be very symptomatic. One of the things that I would tell all the children out there is that if you notice that mommy and daddy get sick, that you should, in fact, be the helper. For those of you children who are listening and don't know who Mr. Rogers is, he was a very calming and reassuring person who passed away recently, but I'd like you to be the helper. Mommy and daddy are sick. You could be the one that take care of them and bring them glasses of water and cups of tea, and that's how we will all get through this if we all get together. That's all for today. I just want to say to everybody, be good to each other, and may you persist like a lentivirus.